All right, if everybody wants to get seated, we're going to go ahead and get started. When the mayor gets here, we'll change our program around just a little bit, and he'll be giving an introduction and a welcome. But first, I would like to welcome everybody here today for taking time out of their busy schedules to really address a community public health issue and crisis that's going on in our community and communities across the country, and that's the issue of violence. And so today, our format today is there's going to be a little bit of business that the Leadership Council, who's represented at this table, and then Mayor Chaluri, you can join us over here if you want. We just have a little bit of odds and ends to tie up here. It should just take a couple of moments. And then after that, we'll have the introduction, and then, of course, we'll get into the core of our program today. So if we could begin, if everybody would please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, our first item of business, we're just going to have a couple of quick housekeeping things we need to do with the Leadership Council. The first is the approval of our August 1st, 2013 minutes of that meeting. Everybody has received a copy of that. There's a motion by Ms. Holt and a second by Mayor Chaluri to approve the August 1st, 13 meetings. Any discussion? All those in favor say aye. Aye. Opposed? The first thing I want to go over with from our last meeting, when we were looking at attendance, all of you have assigned alternates to attend in your place. And after having some collaboration, I wanted to get some feedback, because I thought it might be a good idea that we also had our alternates attend the meetings, and the events that one of you could not be here for a particular meeting. Your alternate is not going to be left so much in the dark of what's going on and what has transpired. So I wanted to bring that up and put that out there if there are any questions or any comments about having your alternates also attend the Leadership Council meetings as well. Great. Well, and again, Mike, you can go ahead and work out what you can work out. And like I said, we're trying to kind of look, just making sure that we have enough continuity that's here. Also, for housekeeping for our guests that are here that are not part of a subcommittee yet, make sure that you have signed in the back and that you have given all of your contact information here so that we can keep in touch with you. The members that were here this morning are part of the subcommittee group. Just for you all, so that you all know, is that this group is going to be very organic and will grow accordingly and appropriately as we need and as we feel we need to add different members of the community. So if you are attending today, do make sure that you have signed in and you have provided all of your information here. For the Leadership Council members, I'm going to pass around a schedule and make sure that you all had the opportunity. Actually, I think Holly, you still had that, or Bob had the sign-up sheet for future meetings. So that is starting to fill in. I think we have sign-ups for you all to host the meetings through February. So I really appreciate you all stepping up to the plate to host a meeting. Again, what we're looking to ultimately do is to have our meetings all across the county. So we don't want this just to be held in the county center or just locally here in Tampa. We have plans to go out to the Temple Terrace, out to the Plant City, and to the different other parts of the county. So all people in the community will have an opportunity, and travel won't be such a burden for everybody, and everybody will have a chance to go and see the different parts of the county and what's happening there. While we're waiting for Mayor Buckhorn here, let me go ahead and introduce some integral parts of our people in this program. Many of you are aware that this initiative was launched started back in January, and so it's taken several months to put all of this together. And while I chair this group, I certainly am not fully responsible for all the work that has gone in here today, as well as the work in the next 12 to 18 months that are here. So I want to make sure that you're aware of some very important people who have helped make this possible and this work that we're going to be embarking on. The first is my legislative aide over there in the corner, Holly East, if you want to stand up. Holly has been give her a round of applause. She has been extraordinarily instrumental in her background and the mental health and the social services sector has been extraordinarily and has really been instrumental in helping us put this together. So Holly, I thank you for your dedication and support. Our facilitator, who is going to be facilitating part of this journey with us, Dr. Herb Marlowe. Many of you met Herb this morning, so Herb, thank you. He's helped the county on many different levels. Robert Salmon, where's Robert at? He's during in registration. So Robert has been part of our internal county team that's been helping with this. And then, of course, another extraordinary person that on county staff that has put countless hours and have helped us in this organization is Brandon Wagner. Where's Brandon at? Is he also outside? Brandon, stand up, yeah. And I think I saw him here earlier. Most of you know him as your county administrator. Extraordinary leadership that he has helped put forward to bring this initiative together. Mike Merrill. Mike, why don't you stand up? Thank you. Well, let me first again thank all of you for coming here today. And I wanted to give you a little bit of background of how this all got started before we get into the primary portion of our program. When Sandy Hook happened in last December, and we were all grappling as a community and as a country of how to deal with such a tragic loss, I started thinking, what could we do in our community? And the journey started out as, like so much of the discussion around gun violence and the level of gun violence and the prevalence of that in our community. However, as we started really getting into and looking what other communities have done, we come to realize that violence related to guns are just a small part of this epidemic that we face in our community associated with overall violence. This issue cannot be solved by a simple piece of legislation. There are many core economic and social issues that move this, that impact this, from poverty to social issues and health-related issues and substance abuse issues. There's all sorts of different factors that play a role in the impact of violence in our community. So with that in mind, we really started branching out and saying, what are other communities doing? How are they addressing this? And through our diligent research, we have found that the underlying factor that impacts violence really requires a community shift in its paradigm and thinking about what violence is. For so often, we have viewed violence and treated violence as a pure public safety issue. And we have relied solely on law enforcement to address this issue in our community. And I tell you, I recognized them earlier, and I can't continue to sing the praises of the Sheriff's Office and their leadership of Sheriff G, as well as in the city of Tampa, Chief Castor, and all of our local municipal chiefs and leaders in law enforcement for what they have done to reduce violent crime in Hillsborough County. Since 2008, violent crime has been reduced in our county by 45%. 45% reduction. Yeah, give them a round of applause. But what we have to realize, again, is that that burden alone can't be shouldered only by law enforcement. It must fall in the back of an entire community. And so that's the purpose of this collaborative, is to start looking at all of the different factors that play in part of impacting violent crime in our community. And so this journey, which we expect is going to be over the next 12 to 18 months, is going to touch many different areas of our community, from the medical community, from the faith-based community, to the mental health community. Law enforcement, of course, will still be involved in this process, but all of you play an intricate part and helping to reduce violent crime in our community. And so what we have found is that Hillsborough County, of course, is not unique. There are other communities out there that are facing the epidemic of violence as well, and they're the ones that are able to really reduce violent crime in their community are addressing it as a public health issue. And in fact, we have found 18 communities across our country who have had extraordinary results, and some of them more so than others. But all of them seem to have one key factor that go together, and that's that they have engaged and embarked on this journey with a non-for-profit organization called the Prevention Institute. And so we have contracted with the Prevention Institute to help us put together a comprehensive strategic plan, a community plan that's unique to Hillsborough County to help us reduce violence. As I mentioned before, this isn't a simple issue. This is a very complex issue that we're going to be dealing with. It can't be solved with just allocating a certain source of money or passing one piece of legislation. It all begins with community dialogue, and it begins by having the conversation and everything starts here in this room. So at this time, I would like to introduce to you the program manager of the Prevention Institute, Annie Lyles, and Annie is going to walk with you of what their organization, what they do, and what we hope to accomplish here in our community. So please join me in welcoming Ms. Annie Lyles.
Thank you. All right, and we'll pause when the mayor's able to join us and kind of go back to that. So good afternoon. My name is Annie, and Benita and I are here from Prevention Institute. We are based in Oakland, California, and we've had the pleasure the last 6 years to work really intensively with cities and counties from across the nation, specifically looking at preventing violence. I'm hearing a little echo. Do you think that mic is picking me up? I don't want to echo in your ears all afternoon here. Or that one. Anyway, I'll be over here. So what we prepared for you today is a little bit of kind of what's going on in other municipalities, the ones that have already been through this process. What was their best thinking? So that can help you out. And we've also prepared a little bit of some of the best available research to share with you today. And then your contribution, the third piece, is how this does make sense or doesn't make sense in Hillsborough County. And so there's really three types of information happening. Other cities, best available research, and your expertise at the table. If any of these are missing, your plan is not going to be as effective, right? And so today is the first step for kind of taking these three pieces of information and bringing them together. We have a framework we use to do that called the 3 Keys to Preventing Violence, and we're going to run through that framework today and pausing to do some activities at your table to get some input. We're actually starting the planning process today, right now. We actually started earlier this morning, so we'll be sharing some report backs from that period as well. Anything else we need to cover? Let's get to it. You got the clicker, Benita? I'm going to steal it if that's okay. All right, so one of the most important things is when we ask people how to prevent violence, they say people have differing opinions. People have differing opinions. But when they ask them what the root causes of violence are, they say poverty and family instability. Usually those are the two most popular kind of person on the street answers. And if you ask them how to prevent violence, they say law enforcement and metal detectors. Okay, now you all are not person on the street, right? But you can see that there's a disconnect, right? Because law enforcement and metal detectors doesn't get to family functioning and I think we have a guest. So we have a bit of a disconnect there between family functioning and poverty and who we place the blame on, or the responsibility for preventing violence, right? And so what the 3 keys helps us do is really unpack how do we prevent violence and what are those root causes and who can do what to really change the community. And so that's what we're talking about in the first place. Before violence happens, what can we do? Should we pause now or? Yeah.
All right, we're going to pause here for a moment and recognize a very special person in our community. I don't think he needs a whole lot of introduction, but he has been so instrumental in building this community over the last couple years, and truly is known for making a statement that this is Tampa's time. And starting here when we're working at preventing violence, this is the time not only for Tampa, but it's also Hillsborough County. So I want to thank Mayor Buckhorn for being part of this initiative, and most importantly, I also want to thank him for hosting us here at the Convention Center. And with that, Mayor Buckhorn, I'll turn it over to you and allow you to welcome everybody here.
First of all, thank you. No, that's all right. I think this is the second or third time I've been in this building today already. First of all, thanks for participating in this. And Kevin, thank you for your leadership, and to all the Executive Committee Leadership Council folks, thanks. You know, we're never going to be a great city unless that rising tide floats all the boats. You know, it's not about the bricks and mortar of downtown. It's not about the hype and the ribbon cuttings and the groundbreakings. It's about creating an environment that is safe, where every community is treated fairly, where every community has an opportunity to succeed, where every young person in this community, regardless of how they started life, or the color of their skin, or the origin of their birth, the country of their birth, has the same opportunity that my kids do on Davis Island. And so what we are doing here, combating the epidemic of violence, is really important stuff. It's important stuff because, you know, what happens in this building here and what happens downtown is all great, and it's important, and it raises property taxes, and it creates jobs and creates opportunities. But if we don't live in an environment where these young people have an opportunity to succeed, and where young black men are not killing each other on a daily basis, where violence, be it domestic or otherwise, is a common occurrence. You know, I get text messages from all night long, basically, from the Tampa Police Department, because I'm on the same server as all of our leadership staff. And when 3 or 4 times a night I have to get up in the middle of the night to look at my iPhone to see of a shooting in East Tampa, or a stabbing, or some other occurrence of violence in my community, that tells me that we've got our work cut out for us. And it's not unique to the center city of Tampa. It's something that all of us face as a county. And the fact that we have brought in experts to help us under the leadership of Commissioner Beckner, and all of you are here, we're serious about this. I mean, we're serious about this. I mean, we can't build a hollow core of a community. And so let's get about the business of fixing this problem. We're not going to cure it. We all know that. It started, Pastor, in the garden when 2 brothers turned on each other. We're not going to cure it, but we can make it a lot better. And we can make sure that those young people have a better future and a better opportunity, and it's not a future that's determined by where they live, or who they are, or what they look like. And this is serious stuff. This is the kind of legacy things that we will leave to our kids that will make a difference. And, you know, when it's all over, hopefully they'll say about us that we made a difference. And so I thank you. Welcome to the Convention Center. Don't get a parking ticket. If you do, pay it. And let's get to work, all right? Thanks, and I apologize for being late.
Thank you so much, Mayor. All right, so one of the things you talked about was making sure all our young people are safe. And for me, the question I ask is, what do folks need in order to be safe, right? What do they need in order to be safe? What does every kid need? What does every family need in order to grow and to thrive? And that's where we're starting. That's the prevention question. Oops, wrong way. So in Oakland, in the Sobrani Park neighborhood, these are the cheerleaders from the elementary school, cute as a button. This is a community very much impacted by violence. And what they said is, you know, when the crack epidemic hit Oakland, neighbors stopped talking to each other because neighbors were stealing from each other, and no one could trust each other, and the young people were growing up addicted to drugs, and just really had fundamentally transformed their neighborhood. And so what their response was they worked with the public health department to work on community connections. They said, we're isolated, we don't know each other, we can't depend on each other, we're all out here acting like we're on an island by ourselves when we have this rich history in our community. We want to get back to that. We want to heal. And so what they did is they wanted to prevent violence by increasing the social connections between their neighbors and the connections between the neighbors and their local governments. So they worked on educating block captains around code enforcement. They worked on neighborhood potlucks. They worked on building a social network back into their community. And they had a 43% decrease in violent crime by the end of the city-county neighborhood initiative. 43%. And this wasn't in an upper middle class neighborhood. This was a neighborhood that had really struggled, and when they were done struggling, but they had never healed. And so these are the kinds of things we're talking about when we're talking about prevention. It doesn't mean that your community's never been impacted by violence. It means you're thinking about what are those underlying factors that help communities thrive. We have this continuum, and I think it's really helpful to think about it. In public health, we talk about primary, secondary, tertiary prevention. They're not easy words to remember. I'm a social worker, so I'm like, I can hardly figure that out. But the good folks in Philadelphia, some young people there said, you know what? Let's call this upfront, in the thick, and in the aftermath. And what we find is in communities, we're often focused on the aftermath and sometimes in the thick, and we forget about investing in those upfront strategies that will keep violence from ever occurring. There's a story in social work about the kids, the babies in a river, different places. Like sometimes when I'm in the Midwest, the kids are driving off a cliff. There's just something terrible happening to innocent people in whatever story. But you guys got a river right outside. So the babies are coming down the river, and everyone's working real hard to pull those babies out and get them the best medical attention they can and heal those babies. But we forget to go upstream to see why they're falling in, right? And it's the courage and the audacity to take a time out from crisis, which is what you have here today, and go upstream to think about what we can do to prevent those babies from going down that river, right? Prevention Institute, we have a beautiful building. I tell that story all the time. All of us tell that story. We had a rainstorm, and a leak opened up on our roof, and we had a big high vaulted ceiling, and we had water pouring into our office, in our financial department of no other place. And what did we do? We ran around with trash cans until the executive director came out and looked at us and went up on the roof and got the leaves out of the drain and then came back down and was like, sometimes you have to go upstream. So I just want to acknowledge that it's a change of thinking, and sometimes it's really easy to get back in that groove again. When you see people suffering, when you see crisis, it makes sense. And if we care about the community that we live in, that we work for, it makes the most sense to go upstream and see if we can't change the fundamental dynamics. So that's what we're talking about. Upfront, parenting skills, quality after school, youth leadership, conflict resolution, social connections. In the thick and aftermath are really important connections, mentoring, mental health, street outreach. These are all strategies that cities have prioritized. So the good thing is that you're working off some of the best thinking of the best city leaders across the country. We're going to be able to bring you the strategies they prioritize, and you can kind of pick through and see what makes the most sense for your community in Hillsborough, and maybe you have some additions. That's the process we're going to be working on. Benita, I'm going to turn it over to you to talk about the public health approach.
Hi everyone, I'm Benita Tsao. I also work at Prevention Institute. I started doing violence prevention work straight out of grad school. I studied public health. And I got this job and I was really excited. And I told my mom, I'm gonna be working on preventing violence. She was like, wait, so you work for the police department now? Like she was totally baffled as to how I had walked this public health path and suddenly was veering off to join law enforcement. And I set her straight, don't worry, it sounds like a lot of you guys are on the same page too, in that violence is very much a public health issue. It's as much a public health issue as it is a criminal justice issue. And here are some very good reasons why. It's just a partial list, but it's a leading cause of injury, death, and disability. Public health cares about lifting up the health of all folks, not just certain groups. And we know that violence disproportionately affects young people of color, people living in low-income areas. Violence also makes a lot of other poor health outcomes more likely. We know that exercise is good for your health. Walking out along the Hillsborough River is good for your health. And if your neighborhood is not safe, you are not going to be exercising. You're not going to be able to find grocery stores in your neighborhood that sell healthy foods at a good price. We know that exposure to violence can cause mental health problems, depression, anxiety. Especially for children who witness violence, it really alters their brain development, so it's harder for them to learn. So violence really not only affects health, but also has all these impacts on other various social issues that we care about, and that really make sure that our communities are thriving and our children are succeeding in life. More and more police chiefs and mayors are saying, we can't arrest our way out of this problem. We really need to start looking at prevention as part of a long-term sustainable solution. And public health is really the prevention experts. And this is really the 4 tenets of the public health approach to preventing violence. First off, it's population-based. We really care about working with entire groups of people. It's important to intervene with individuals and families, but we're really focused on the impact you can have when you're working with large groups of people and affecting them all at once. And we also focus on prevention, which is what Annie was talking about, moving upstream. What can you do before the crisis, before something bad has happened, and kind of intervene before people need healing and medical care? Reducing risk factors. Risk factors are all those things that make violence more likely. They're things that have come up already in the conversation: poverty, lack of jobs, academic failure, things like that, and we'll talk a lot more about that later. But we really want to reduce those things, make them as small as possible. And we want to also increase resilience factors. There are all sorts of things that are going well in Hillsborough County. Resilience factors that are helping bring the violence down. Resilience factors not only protect against violence and make violence less likely, but they really buffer against all the negative impacts of risk factors. So instead of just focusing on all the negative things, it's also important to look at what's going well, what is protecting communities and families that we can build off of and enhance. And we know that the reason why I think there's a lot more attention these days on the public health approach is there's a lot of evidence that it works. Prevention works. It's really exciting. Here are just a few examples of that. Universal school-based violence prevention programs can reduce violence by 15% in as little as 6 months. That's all it takes, 6 months, put in place a violence prevention program that doesn't just yank the bad kids out of class, but really is about changing the entire school climate. So the staff, the students, everybody in that place feels that they're respected and it's a safe place to learn. Those are universal programs and they can have a big impact. Another example is street outreach and violence interruption. Have you guys heard of Cure Violence? Anybody? We've got one hand. It used to be called Ceasefire Chicago, if that helps at all. They made a documentary recently called The Interrupters. But what they really do is they train people from the neighborhood, often people who have been incarcerated before or have a history of gang violence. They train them and they train them to mediate conflict. So they have credibility in the community, and they're saying, I turned my life around, let me help you turn your life around too. This has been shown to decrease shootings and killings by up to 73% in 3 years, and they also saw a 100% drop in retaliation murders. So we talk a lot about the environment. Street outreach and violence interruption is one place to sort of stop the shootings and killings, to create the space to start changing the environment on a broader scale. Another example is Summer Night Lights in Los Angeles. This is a strategy similar to Cervantes Park in that they really wanted to create places and times for community to come together, to build those neighborhood connections. So they decided, let's keep the parks open late at night. We'll have singing competitions, karaoke, chess tournaments. You can learn programming, video games. They had all sorts of different activities happening at the same place in these parks. Churches would cook for families. People would come out. Gang outreach workers were there, making connections with youth. It really was really exciting, and it's been going on for quite a few years now, and they've seen a 57% reduction in gang-related homicides in the city. So how do you think they made this happen? The answer I'm going to give you is it's the public health approach. And we're going to give you a framework to kind of make this happen in Hillsborough County also. It's 3 keys. We're going to walk you through it and provide a bunch of examples. And of course, if you have questions as we go through this, please feel free to raise your hand, and we'll try to address them as well as we can at this time.
So let me talk about the 3 keys. We're going to give you a lot of examples today just to give you a sense of what's possible. If you want more information on any of these examples, those 3 that Benita just did have rigorous research behind them. We're happy to connect you with that, okay? If you just send us an email, we'll give you our emails. Anything we'll be happy to connect you with after today. So how do you make this happen? 3 keys. Easy as 1, 2, 3, right? So 1 is that violence requires a comprehensive approach. if there was one program that you could adopt and that it would decrease your violence, we wouldn't be here. We would just mail you the curriculum, right? So if anyone tells you it's one thing, you should really question that. People are complex creatures that come to violence because of different ways. People respond differently in different situations. One thing isn't going to solve it. You need to think comprehensively. And one of the reasons to do that is when you think comprehensively, you can change environments. This is a quote from the Institute of Medicine. We like to say, it's unreasonable to expect that people will change their behavior easily when so many forces in the social, cultural, and physical environment conspire against such change. When we talk about programs and like the one curriculum, we're forgetting that people live in environments, and they're very much impacted by the environments around them. I told this story today about eating peanut M&Ms in my office, that there was a dish of them, and all of a sudden my peanut M&M consumption had gone through the roof. And it was just access to peanut M&Ms. You took that peanut M&M jar away, it's gone. I'm not eating any of them. I'm not seeking them out. And for so many people, young people especially, what's available to them in their community really impacts what they're participating in. And especially at that kind of adolescent stage where we know violence is kind of the most, they're most at risk for perpetrating and becoming victims of violence, their identity is all over the place. They like punk music one week, and next week they like country music. You have an opportunity. It's a great window to start thinking about giving them a real healthy alternative and a healthy idea about what they can do. That's what the public health model does. It changes the environment and makes the healthy choice the choice that is much more widely available. So we have this model. So you have health and safety, and it's impacted by environment. And for a lot of people, they put behavior within that too, right? So the environment impacts your health and safety, but it also impacts the individual's behavior. And I'll give you an example, lead, right? Anyone here for kind of the old days of lead and lead paint and lead gas, right? So how did we eradicate lead? What did we do as a nation? We took it out of paint. What else did we take it out of? Gasoline. Now you could have created a curriculum and went into the schools and taught children not to eat lead paint. You could have created curriculum and brought families together and taught them not to let their children eat lead paint, right? But that's not effective. And that's how we've been treating violence. And it's been one of our limitations, is that what we need to do is change the environment and get the violence out of the community so that folks can get back to the business of being family and being neighbors, right? So what we're doing is we're looking at what we can do to change that environment to impact behavior. Now, skills are important within this, so we'll talk about skills as well. But we focus so much on individual and skills, we have missed the big picture, and that's what public health asks us to go back to do. We use a model at Prevention Institute called the Spectrum of Prevention. This is how we change environments. So I'll tell you, I was a social worker at a middle school. 1,400 kids, and how many social workers? One. Right, one. And I came in, I was interviewing for the job, I really wanted the job, I lived in the neighborhood, had deep roots in the neighborhood, and I said, look, I can't social work your way out of this issue in your community, but I have this model, the spectrum of prevention. This was before I actually got to work at Prevention Institute. And I said, let me be a social worker that's involved in the school policy and the school decisions. And let me be some kind of a connector to community groups so that I'm not just doing clinical work with individuals, I'm also bringing in community to the school. I'm also thinking about how the policies at the school can better serve some of the students and the families based on, my expertise. And they went for it. And we did things like bullying surveys to find out where bullying was and change the staffing patterns and change the lunch area to make our kids more safe during school. These are the types of things I'm talking about. When I say comprehensive, I don't mean that we need to, throw the book at this, right? We need to be strategic about what we can do and start building those relationships to do it. I'm going to turn it over to you, Benita.
All right, so we're going to go through each level of the spectrum and give you an example. And it starts with individual knowledge and skills, which most people are really comfortable at. You guys know what this is, right? Yeah. Even though we talk a lot about environment, changing the environment can take some time, right? It's not going to happen overnight all the time. So that's why individual knowledge and skills is still so important. You still have to give people the wherewithal to prevent violence however they're able in whatever circumstance they're in right now. And that's what strengthening individual knowledge and skills does. So one example of this is Second Step. This is an example of a universal school-based violence curriculum. What I love about this is when they implemented it in Livingston County, which is a rural part of New York, they said, we're not only going to make sure that all students get this and all staff learn about empathy and about controlling their impulses, conflict resolution in peaceful ways, we're going to make sure that all of our students and staff get that, but we're also going to bring it out into the community. So they worked with youth-serving organizations like the YMCA and Boys and Girls Clubs. Those nonprofit organizations went through the training too and delivered it to parents. And so not only were the young people doing this in school and modeling this behavior and practicing, but that behavior was being reinforced in all these other aspects of their lives too. So that's one example of an individual knowledge and skill program that can kind of start spreading into the environment a little bit too and working in the community level. Promoting community education is the next level up in the spectrum. You'll start noticing that as we move up in the spectrum, the bars get a little wider and wider, and that's to suggest, that's when you're going to start having a broader and larger impact. You're reaching more people at once this way. Community education is a big component, actually, of the NOLA for Life. Have you guys heard of this plan? It's New Orleans murder reduction strategy launched by Mayor Landrieu last year. They've actually done a lot of stuff around communications. They have billboards, they have the public access TV station has original programming all about what's available to residents, sharing really positive stories about young people, not just the ones where they're getting in trouble. They use social media really well also to post job postings. Like, you're looking for a job, here's the job of the day for you. They use it to publicize neighborhood events, midnight basketball. And this is a photo from a NOLA for Life event at a park where city and county employees came out to fix potholes side by side with residents who were cleaning out street gutters. It was really bringing the community together to not just pitch in and work and demonstrate that this initiative is not just for African American young men, it's for their friends, their families, and their communities. But it was also a way for the community to hold the leadership accountable for what the mayor said he wanted to do and the changes he wanted to make in the city. Educating providers.
I'm gonna hold on to it. So the next example, go ahead, is from Ramsey County, Minnesota. And we brought it in because it's a great organizational example. We're all part of organizations, and all of our organizations can take a minute to think about what we can do in our interactions to make ourselves less likely, or to decrease the likelihood of violence. This is an example with the Children's Museum. And the staff there had access to a lot of parents that were stressed out. And whether it's domestic violence or community violence or child maltreatment, we know parents that are stressed are a risk factor. And they said, well, we're a museum, so we're not gonna, roll out a street interrupter program. But we can think about how we design our museum, and we can think about our interactions with these parents and do a better job. And so they actually redesigned the museum to make it more accessible for parents and for children. And then they also train their staff on how to talk to families and help cue them around behavior within the museum. So that it's not a museum person, sternly looking or yelling at your child, but they turn their museum workers into coaches for healthy parenting for parents. And it was subtle, but it was strategic and it was intentional. And Benita, I think they've had great results, right?
They've actually had debrief programs where people who have tried to intervene and diffuse kind of tense situations between parents and children, they have a chance to talk through it. They get a lot of technical assistance from the county health department, which runs, I think, a family violence prevention program. And they've really seen their visitation go up. The customer feedback they're getting is really glowing. I mean, it really is changing how they do business, and they see it as a customer service program, strategy.
There's another example of the library in Salinas. If you ever want to really get blown away by preventing violence, the librarians in Salinas, California, have taken it to a whole other level. They said that, there's no reason, if a child is enrolled in school, there's no reason that they need to fill out a library application because the city already has their information, the school has already gotten that information. So if they're enrolled in school, they should be able to get a library card. They went to the school and they awarded children library cards, made it a big deal. And what happened to library use in that community? 1,000% increase. They kept going. They said, okay, we got the elementaries covered. We're going to the junior highs. They went to the high schools. They're working on suspending fines and working with young people to figure out what to do about fines. And they've started a youth soccer league behind the library. right? Now, I'm not saying you need to start a youth soccer league within your organization, but there's some opportunities to think about how your policies can support families and what you can do in your own organization with your own business. In San Diego County, they looked at crime-free multi-housing. So this is the housing group and the sheriff working together with some CBOs to train landlords and property managers on how to promote safe, healthier living environments. They've had a 90% reduction in police calls from high crime rentals. They've changed the environment that these folks are living in through training and working together. This is a great example. They have a lot of data. One of the times is we think a lot about law enforcement in this response, we think of teachers, and we forget some of those other providers that are more informal in our communities, and that could be the coaches, and I have the DJ there as the morning talk show. There's a great curriculum called Coaching Men into Boys.
Boys into men.
Yeah.
Let's not regress.
That's
now.
what the media already does, right? Yeah. So coaching boys into men is a really interesting thing where they've said, you know, young men look up to their coaches. And sometimes there's been a history, a culture in coaching of being domineering, being overbearing, being physically abusive, which carries out and makes violence more likely to occur. If the person you look up to is verbally abusive to you, what happens when you go out into the community, right? And so they've really taken coaches and said, you know, you're a coach. Here's how you coach. Here's how you support the development of the young men that you care about. They also have a program called Team Up for Youth that's looking at recruiting more young women to be coaches for other young women and really bringing up the role and the responsibility of young women to also be coaches. So that's a really interesting kind of opportunity to work with coaches, and I think we'll keep moving.
Yeah. I mean, we really just want to push you a little bit and broaden your idea of what a provider really is. A provider is really just someone who has a lot of contact with lots of people for the population you're trying to reach. And already we've talked about librarians, we've talked about people who work in children's museums, DJs and coaches. I mean, these people have a lot of influence and reach if you're able to recruit them to your cause, which in this case is preventing violence. Fostering coalitions and networks. No one can do this work alone.
Right.
It's not going to take one organization, one person. It really takes lots of people coming together and doing this together. So anything you can do to foster coalitions and networks, to build up that trust and those relationships is going to help prevent violence. One example, which the data subcommittee, I'm sure, is just going to salivate over, is this data sharing system in Louisville, Kentucky. Louisville Metro Office of Youth Development. They worked with, I think, they decided, you know, we've really mapped all the services and programs for young people in our area, but it's really just within youth-serving organizations. We really should reach out to work with the Jefferson County schools. So they decided on this partnership with the school district where they shared data. 80 different youth-serving organizations installed this software, and they made sure it was compatible with the school district. And now all these youth-serving organizations have real-time data on attendance, on standardized test scores, on grades, and they can say like, oh look, this young person who we work with 3 times a week, they're not reading at grade level. We need to more intensively assist them before the next test, and so they're really set up for next school year. After they put this system in place, the number of students who are reading below grade level decreased by 75%. So they're really using this as a way to continually improve their programs to better serve youth and set them up for success. And the school district is really happy because their students, they're getting some extra help to make sure that their students are succeeding and not falling through the cracks. The other great thing about this story is that it wasn't just schools and youth-serving organizations and the Louisville Metro government. The system they used to track the young people when they would enter the facility to get services and participate in programs, those cards could also be used at the library. They could use them for discounts on bus rides and public transportation. I mean, they really thought this through, I think, and made it part of how the Metro County does business, Metro government does business. Another example is in Philadelphia, greening vacant lots. Who would have thought, right, that the way that your neighborhood looks and feels is going to affect the likelihood of violence? Apparently there are thousands of vacant, abandoned lots in Philadelphia. I had no idea before I learned about this program. And so it really was affecting people's lives and whether they could attract businesses. The Economic Development Department in the city really wanted to address this issue, to attract investment and new businesses. And so they decided to partner with the local horticultural society They said, what can you do to make these places more attractive? So the Horticultural Society brought in business and said, hey, these nurseries, can you donate some sod, some plants, some seedlings? And they created these beautiful park spaces. They're kind of lawn, lots of lawns. I don't know if you can actually like sit and hang out there, but at least it just made the neighborhood look so much more attractive. People reported reduced gun assaults in those areas. Residents said they didn't feel as stressed out and they were exercising more because of this intervention. And they also recruited local people to maintain the park spaces. So the local Horticultural Society actually planted the trees and the grass, but then a local nonprofit that works with homeless people and folks coming out of prison said, hey, we're doing landscape job training. Like, let's have local folks maintain this space and make it into a workforce development strategy. So you're starting to see how all these different players at the local level are coming together to implement these strategies, and really they're becoming much more effective because of these partnerships.
Benita, let me add one thing on that. One of the things that's interesting when you look at data, they actually had an increase in reports of police calls in those areas. And so at first they said, well, we failed, right? We've got an increase of police calls to these vacant lots. But what was happening? People started to care. They had their eyes, and they weren't okay with it happening in their community anymore. And so you saw a spike, and then you saw a gradual decrease. So it was an interesting thing where we had to unpack the data a little bit as we looked at the effectiveness of the strategy.
Yeah. All right, changing organizational practices. I think a lot of people struggle with this. Like, what does that mean exactly, organizational practices? But it's really just how you get things done, right? Like, what are the steps you have to take? What's the protocol in place for you to get from point A to point B? There are organizational practices at the DMV for renewing your driver's license. There are organizational practices for, getting pens, in government sometimes. I mean, there are just all these systems that are set up. And how can we really assess those organizational practices and make sure that they're supporting violence prevention also? Does that make sense? All right, so one example is in Baltimore. They decided to revamp their zoning code. It's the first time they've done that in 30 years. And the city council was like, okay, planning department, you guys are in charge, you figure out this process. The planning department said, well, we haven't done this in a while. What new do we want to incorporate into this protocol when we update our zoning code? And they decided to incorporate health impact assessments. Have you guys heard of health impact assessments? Anybody? Where are my health people? Oh, in the back of the room there, all right. So health impact assessments are really this process where you go through different changes in the zoning code and proposed changes and say, how is this going to affect health and community health and safety? So it's really thinking through, if we implement this, what might happen downstream that could affect health and safety. So they decided to do this up front, right? This process where they did this health impact assessment. They really thought about how different changes in the zoning code could affect healthy eating and active living, as well as violence and safety. And part of the process is to involve the community. Part of this process is interviewing stakeholders, making sure that residents actually had a voice and saying, this is what's important to us, this is what we want our neighborhoods to look like, and have the code kind of be responsive to that and support that. As a result of this process, they ended up recommending reducing the concentration of alcohol outlets in low-income areas by making a lot of the liquor licenses conditional, for example. They also recommended crime prevention through environmental design. So how do you use lighting and landscaping to make sure that people feel safe walking around the street, shopping, and can kind of keep their eyes out for anyone who might be committing a crime. Joint use agreements are another great example that has really become popular in recent years. Joint use agreements are most common, I think, with schools or other public facilities where they usually shut down at a certain time, but the joint use agreement allows them to open their doors to the community for other uses after hours. So a lot of times schools will shut their doors and lock the gates at 4 p.m. when the students are no longer there. Joint use agreements says, we can open up the facilities, here's who's responsible, here's who's liable, and it means that community members can use that space, use the playgrounds, use the gym as a safe place to be active and to come together. An example is in Pixley, California. This is a rural farming community, and a lot of the parents had come together to teach their girls cultural dances, but they didn't have a space that they could use that was cool in the summertime. It gets really, really hot in Pixley in the summertime, and so they would have to suspend all of these classes when it started to get hot. And because of a joint use agreement, the school was able to open up their gym, and this group was able to participate year-round, performances, classes, and they also started hosting dinners and for other folks in the community to make connections and get involved. So just having a joint use agreement just creates those safe spaces, especially in neighborhoods that are most affected by violence when there aren't a lot of alternatives. This is a great way to make sure that people have access. And finally, policy and legislation. How are you guys doing? Questions? We've been rushing through this, I feel like.
We are, but we're gonna transition here in just a second. So why don't
All
you go
right,
through those
so the
two.
last level is policy and legislation. This is how you're really gonna start reaching the most people at once. Organizational practices, I feel like they affect clients and employees, and they can kind of set the standard and pave the way for effective policy. One example of this is in Oklahoma, where they decided to make universal pre-K available to everybody who wanted it. This is most successful because I think they made sure there were really high standards. They paid pre-K teachers the same as any other teachers. It wasn't considered kind of like a subpar assignment. All the teachers had to be certified. And it was also integrated into the K through 12 public school budget. So it wasn't something separate, it wasn't an add-on, and it wasn't something that could be cut out easily. They really wanted to say, we know that pre-K sets kids up for success. It gives them it gives them the chance to start practicing social skills early. It means they're ready for kindergarten and first grade and second grade and so on. It really does make a huge difference in terms of their development and their skills. And another reason this was successful is there were partnerships involved. It wasn't just the burden on the school system to provide this for all the parents who wanted it. Nonprofit organizations and private entities could also receive funds to make this happen. And I think Oklahoma now has one of the highest pre-K participation rates because parents really wanted to do this. Once it was available, they really said, yes, sign my kid up. It's definitely not a mandatory program. It was just making something that a lot of parents wanted already available and easy to access. Oakland Unite, I love talking about where I work and live in Oakland, and I'm looking forward to hearing more stories about Hillsborough County where you guys work and live. But for 10 years, Measures Y and BB have generated stable long-term funding for violence prevention. This is a parcel tax and a surcharge on commercial parking lots, and every year, all those little bits of money from the tax and the surcharge end up in this big pot, and it generates $19 million every year. Some of this money goes to community policing, so law enforcement gets a big chunk of it. It also goes to keeping fire stations open 24 hours. But it generates about $7 million every year for specifically youth violence prevention programs. We keep saying that you can't do this overnight. It really does take a long-term commitment. And one of the biggest problems is where is that funding going to come from? At least in Oakland, we've found a way to make that happen, and it's really paying off.
And that actually was just up for they voted on it. They just re-voted on it, and it passed. So even in a time with really tough fiscal constraints, it was interesting. It's the perfect three. They did a lot of polling. We were on some of the behind-the-scenes stuff that if it was just firefighters and law enforcement, it wasn't going to pass. If it was just youth development, it wasn't going to pass. But if it was all three of them together, people felt really confident about it. And I thought that was an interesting kind of finding from that, is that when people thought of public safety, they really wanted all three of those pieces, especially those firehouses in their communities to be open, and the youth development kind of flowing down. So what I'd like to do now is, the sum is greater than the whole of its parts. We'll just acknowledge that.
I think the thing about this is that all the different levels of the spectrum, you'll notice that some of them bled into each other a little bit, right? A lot of them involved community partnerships, even if it wasn't categorized as the coalitions level. And really the idea is that all the different things that you're doing at all the levels of the spectrum should reinforce each other. They should all be mutually reinforcing and build on one another.
Yeah. So what we want to do is hear a little bit about some of the top things that you're interested in Hillsborough. You're gonna work at your tables to do an activity around this, but I just want to hear a little bit. I've heard some interesting stories about reentry. I heard some really interesting stories about climate surveys at schools. What I'd love to get is a couple different examples of what's happening for preventing violence in Hillsborough County. So we have someone to run a microphone, I hope. Yep, you are the official runner. And it is really important that we get you on the mic just for the communications piece. She's got it. So let's just get 4 or 5. So we don't want an exhaustive list, but let's focus on Hillsborough for a minute. And what are some examples of good, strong prevention practice here? We have in the back there. Can we get a second mic? We've got a second mic here. Can I get someone to run that?
Hi, I'm Nancy Newton. I'm the director of the USF Center for Victim Advocacy and Violence Prevention. And 4 years ago, we started a program that we call REAL, which stands for Relationship Equality and Anti-Violence League. The students came up with that name. And we have sort of a famous T-shirt around town. It's black, and with white lettering it says "Got Consent," like the Got Milk campaign. And on the back it says, "Real men respect, real men ask, and real men listen." And the entire program is based on trying to enlist men on campus to end violence against women. And we teach, with male peer educators, we teach pro-social bystander intervention techniques to do so. And I've just had a meeting yesterday with a faculty member so that we can start a 2-year assessment of the program using empirical evidence. But our non-empirical data says that it's working pretty well. Initially, like you said, we had a 47% increase in the numbers of reported gender-based violence incidents after the first year, and then it has slowly gone back down again. So we believe that it just got the word out as to what our students would and would not tolerate.
Great.
Thank you.
Thank you for that. That's a great story because we kind of saw the whole piece. I'm going to ask for the rest of you to give us short sound bites, though, so we can do a couple more so that you can work at your tables and get chatting a whole bunch more. Here we are. Thank you.
My name's Jay Murphy with Healthy Start, and we are the lead for Healthy Families, which is a child abuse prevention model. We're funded by the Children's Board, but we have a 99% evidence-based program that those children that are at risk for child abuse are not abused. So you start with the little ones first, I think.
All right. Thank you. Good news. Lots of good news here. Let's get a couple more pieces of good news. We got right here in the front.
Hi, I'm a school resource section supervisor with Hillsborough County Sheriff's Office, and I'm very happy about, we've had school resource deputies in Hillsborough County Schools since 1977.
Oh.
We have a very good working relationship with Hillsborough County Schools. We have 46 middle and high school resource deputies. And to give you an example, the other day I went to Armwood High School, and my deputy was in a closed door meeting with the captain of the football team, mentoring him about his study habits. So they do a world of things in the schools, and I think it's a very positive thing for the county.
Thank you. All right, one more, and then we're going to go to tables.
We have the free medical clinic, Red Crescent Clinic, that's free medical care for anybody in Hillsborough County. You have to call and make an appointment to go there, and it's been in existence for several years, and it's a big outreach to the community for a lot of people who don't have health coverage.
Yeah.
And they do have specialist doctors in the county that volunteer their time there.
That's wonderful. Thank you. So part of our plan in creating this county-wide plan is thinking about what's already existing and what are some things that you've had on your wish list probably. So kind of looking at the parameters that we brought up today, so thinking about organizational practice, thinking about policy, coalitions, and networks, what we'd like you to do is to work at your table and put together a spectrum of prevention based on your best thinking. We'd like one person to be a note taker for the group, and we'll give you an extra copy of this to do that, so that we can collect that back and start figuring out what are some of the strategies that are already in place, And what are some of the strategies that you would like to see? So it should be in your packet. And I think Robert probably has extra copies, so we can get some extra copies out for you. But we're going to take 10 minutes for you at your table to discuss this and kind of fill it in as a group. And then we're going to come back together because we've only talked about the first key, which is the strategy, and we want to get to the second two and get you out of here right on time. So 10 minutes to put together your draft spectrums, talk about it. One person will be the note taker. If you need an extra copy, and just get a hand up and we'll get you an extra copy of the spectrum worksheet. All right, they're coming right over. And Benita and I will be floating. So also if you want Benita and I to answer any questions for you, we can come right over and help with that too. All right, I'll talk to you in 10.
Out of the criminal system, and then mentoring people to try to get them, prevent them from having that type of way of life. But those could never be a paid job in Hillsborough County because they can't be employed with youth if they have those kind of charges against them. So it's kind of like something that needs to change and be discussed in legislation.
Yeah. Quite a few cities have a ban the box charge where they've taken out that question until the interview. And so if folks have a criminal record, they have, there's some thoughtfulness about when a criminal record is important for a position and when there could be some parameters in place.
Not in Hillsborough County, though.
Yeah. So I'm just saying in other places there's some models to review and to kind of explore. Great. Thank you. All right. Anyone else want to share their policy there?
We identified 3 areas. One of them is potential policy changes as it relates to suspensions in the school system and perhaps how to intervene with behavioral modifications and things of that sort instead of the suspension. We talked about a better need of addressing rehabilitation for individuals that are actually in the Florida State prison system and ensuring that from the moment they hit the system that there's a rehabilitation component, that we don't wait until a year before they're going to re-enter into the community. And we talked about the problems that we have right now with trying to protect our youth from abuse, perhaps within the home or their environment. And the problem that we have right now where primarily there's a big focus on criminal activity, and on one side, file criminal charges, and then on the other side, reunify the family. And a lot of the horror stories that we hear about is something's pending in the criminal system, but there's been a push here to reunify, and the two systems may not speak to each other, and there may be limited access to information that's critical for the judges as well as for the state attorney to know before they move in any particular direction.
Okay. I think some of the examples you brought up, I think, bring up a really important distinction is sometimes there's changes in infrastructure and sometimes there's changes in kind of the skeleton of how we work outside of the community, and both are really important. And what's great is a lot of times we forget to do those infrastructure pieces as part of our strategy. So thank you for bringing that up. So this is the type of things that we're thinking about. These are all wonderful examples for things that you're already doing, things that might need just a little bit more attention, and you have a lot more on your papers. What I'd like to do is if we could have, if you could hold up the paper that's going to be turned in from your table. One person volunteer their paper. The 4 of us will come collect them just quick. So let me get one from each table. Don't be shy. Let's get one. She's coming. All right, we got yours? Taking yours. Thank you. You need a minute? Okay, all right, you're gonna, oh yeah, we have a bunch of blank ones. I'll get another one for you. You have to promise me. Okay. Can we get her a blank, this table, a couple blank ones? And, we'll accept these on a revolving basis, so if you have any more ideas for strategy, please send them our way. All right, so the first thing I think you've got really well is that, you're not going to prevent violence by doing one program. You're not going to prevent violence by teaching, a couple middle schoolers how to solve conflict. It's really about coming together and thinking through this problem. The second key is when you think about the issue, you want to focus on risk and resilience. And we started that discussion there this morning. Benita gave me the clicker. I lost my... Okay, perfect. I want to make sure I hit the high notes here. We're going to move a little bit quickly through this section, but again, these are all things we'll revisit throughout the process. So risk and resilience factors must be addressed. These are the things you want to see changed. This is a great quote we like from George Albee. No epidemic has ever been resolved by paying attention to the treatment of the affected individual. You can't solve a problem by just treating the folks that are most impacted, because you're not stopping the transmission of the problem. You're not stopping the contamination that's happening. And so when we think about risk and resilience, this is about looking at those factors. And we talked this morning a little bit about the socio-ecological model and how all these things play into each other. And we went through risk factors and resilience factors. One of the things that's important to note is that if you just focus on risk factors, you are less likely to be successful. When we talk about risk, and Benita's already smiling, we talk with them about risk and resilience factors, they say, well, there's like 600 of them, right? And there's 600, probably more, established risk and resilience factors. If you look at the evidence, if you look at the data, there's peer-reviewed journals, blah, 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 blah. So what do you do with that? If CDC hands you 600, that's a long list. What we've done is we've asked the folks at cities to prioritize the ones that were most impactful for cities. That's where this list came from. So this is not an exhaustive list of risk and resilience factors. There's probably some other ones. But we've asked the other folks to do that hard work so that you could start with the ones that were most impactful to cities generally. Your work in your subcommittees will be figuring out which ones make the most sense in Hillsborough County. But we have very strong research evidence from the highest levels of the federal government that these things, if they change, will make violence less likely to occur. And they also know that you can't just choose from one side or the other, that there needs to be a mix of both. So when we think about a comprehensive approach, we're picking a few risk and resilience factors to focus on and some strategies across the spectrum that will move them. Okay? It's a little bit of this and a little bit of that. Now, you can't actually choose a strategy that's wrong, because all of them work. What you can choose is one that folks will not get behind because it's not relevant to your community, or it won't be very impactful because this issue isn't kind of at the top of folks' agendas. So what we ask people to do usually is develop criteria. And so we ask people to develop criteria. Let me go, hold on. Oops, well, this wasn't what I thought it was. Benita, we don't have the one from Reading with the criteria they chose? Oh, okay. So when we do this kind of risk and resilience, we ask people to kind of go through a list of criteria, and we'll have that out for another day. But with that criteria, we want to choose the ones that are most impactful for your community and the ones that you think make the most sense. This is, I feel like you should cover your ears a little bit, Commissioner, because Commissioner really likes data. I've already known that about you. And violence prevention is art and science. So this is the science, and now we're getting to the artistic part of circling the things that are most relevant to us. Because we have good science and good data behind all these things. In the morning, we asked subcommittees to think through the generally for Hillsborough County. So I wanted to share the results of that. And Benita, can you describe that for me? So there were 6 pieces that there seemed to be really strong consensus from that list. There's some outliers that I think are worth developing further. But from this list that you have, the large group came up with 6 risk and resilience factors that seem to be rising to the top. Do you want to guess what any of them are? You can. What's your favorite one? Yeah, do you have a favorite? I'll tell you, my favorite one is meaningful opportunities to participate. It didn't come up this morning. And that's okay, I still like you guys. But it's my favorite one. I think that when folks really feel like they have a meaningful way to participate, whether it's young people or those that are usually marginalized, if you really want to see them come alive, it's give them some responsibility that they feel like they can do. Now, you can have a great violence prevention strategy that doesn't include that, so I'll acknowledge it. What's your favorite? Community support and connectedness. That's also one of my favorites, hence the Sobrane Park example this morning. All right, anyone else got a favorite? Who's got a favorite? Totally okay to play favorites in this because we're all going to work collaboratively. You know what came, oh, that's right, because they actually, okay, well, let me tell you what came up and then we can talk favorites. Because a good portion of this room actually knows what the 6 favorites were. This is a very good point. Thank you, Carolyn. All right, number 1, by far, up and away, almost every group said this was important, coordination of the resources and services. And as a facilitator, when I hear that, I think, all right, well, we've got something to work with because all of you play a role in making that happen, right? So that's good. We can do that in a strategic plan. That's no sweat. Next one is employment and economic opportunities. Thinking about how the things that you're already doing to work on economics and employment can have a violence prevention lens to them, right? So it's not necessarily doing something different with your economic work here and your employment work, but putting that lens onto it. Another one that came up was mental health and substance abuse and access to services and thinking about those. Again, you already, I'm sure, have all kinds of efforts around mental health and substance abuse. How do those link in back to violence and connect back to violence prevention services? Next one that came up, community design that promotes safety. So thinking about land use, zoning, landscaping, parks, there's all kinds of interesting things around that happening. What does our community look and feel like, and how does that impact its use? One of the things, there's CEPTED, people are familiar with that? Community... Crime prevention through environmental design. And so like some of the, I don't know it as well, but the basic tenets are the bushes should be this high and the trees have to be cut here so there's like a vision. And they thought that was pretty effective, but what they realized, if they didn't have coordinated activities in the park, they still weren't successful. And from my social work background, and I already told you I like meaningful participation, like I'm like, yeah, that's what I can get behind. Like trim the tree, trim the bush, but then really have a coordinated place for people to have joint use and think about what to come into that. So I like CEPTED a lot, but you also want to think about what's that human element, how do you tie those two together? All right, those are the 4. We have 2 more I want to kind of lift up, was parent-child relationships and connections to caring adults. Was thinking about how we're supporting families, especially in families that are stressed. What kind of supports are available to them? How do we make that parent-child connection happen? And I'll give you an example. I always say I have a brand new baby, but she's 2, so she's, I don't know, a brand new toddler. But I had great prenatal care. I had great access to great care when I was pregnant, and I signed up for all the classes I could because this is my first child. I don't know what I'm doing. I know enough to know I don't know what I'm doing. And the classes were free, and it was a great mix of moms. You know, incomes, varied levels, different ethnicities, just totally different backgrounds, having this shared experience. There was a small fee, $45, for a 7-week childbirth preparedness class that was all about connecting with your baby and your partner. And in that class, it was all upper class white women. And so I had walked into this room and I thought, what's the difference? Every class I've been to in the hospital with my provider, I signed up in the same place. The difference was $45. And this was the class that was most impactful. This is the class where all of a sudden we all made connections to each other, and I had a new social network, and my partner had a new social network, and we talked about attachment to my child. And it was when I finally had the child, when I was like, talk about stress, new babies, I had this amazing network. And I just thought, wow, $45 is the barrier for this? And my healthcare provider, I wasn't calling the healthcare provider because I had a great network that was helping me. Excuse me. And so those are the little things that you can think about when you're thinking about how to support parents, because it's not necessarily the parenting class, It's the policies around the parenting class. Are you with me on that? It's the accessibility for parents. How do parents feel welcome coming onto your school campus? You know, what are we doing as an organization to make ourselves a parent-friendly? One of the things that museum did is they changed their waiting areas. Like, we can all take a lesson from McDonald's, right? Like, you let your children go to the play area, and then you can order and pay in peace, right? And it's done quick, very quickly, right? So there's something to be said there for the way we set up our services for parents. All right, last one, weak health, education, and social policies. Again, as a facilitator, I'm so excited. Leadership Council, you know, this is what you kind of focused on too, is that there's some opportunities within our health, education, and social policies to be more thoughtful, to kind of take another lens to those. So, you know, there's still a lot more risk and resilience factors, but I want to share that this was the initial kind of piece that I quickly clustered during the break based on the feedbacks from the large tables. Each of the subcommittees, also based on their content area, lifted up some specific risk and resilience factors for their sector, which I think makes a lot of sense. And what we'll be doing in between now and when you see us again is doing some more clustering and some more kind of feedback and reviews to get this refined a little bit further. Any feedback about missing pieces that you want to add to this list? Any reflections on it? This is initial. This is our first thinking. Great. How are we doing on time? Perfect. All right, so key number one. If you want to prevent violence, you need to yes, it's a comprehensive approach. And key number two is what? Risk and resilience. And key number three is, if you think about this is the present, this is the bow on the package. So key number three is wrapping it all together in a strategy with a plan. And I'll turn it over to Benita and give you the clicker to wrap us up with that.
So key three is really about coordination, right? It's not enough that you have all these great things happening in Hillsborough County, you're hitting all the different levels of the spectrum, but if it's not sort of all under one coherent umbrella and people don't know what other people are doing that might complement their work, then it's not gonna have the impact that you want. So key three, preventing violence requires an integrated strategy for action. It's really, how is this being coordinated and how are people communicating about their work and how can we support each other to do the pieces of the spectrum that address and shift these risk and resilience factors. So Deborah Prothostith is a person we work with very closely. She's one of the first people who started talking about violence as a public health issue. She's an adolescent physician. And she said, violence is not the problem of one neighborhood or group. Coming together and owning this problem and the solutions are central. And that's really why whenever Annie and I travel and we come out to places like this, to come into a room like this, where you have such committed people representing all these different sectors and really saying this is an issue that we care about and we want to move it and address it, is so moving and powerful. This is really the first and most important step, I think, in making sure that you're preventing violence where you live and work. This happened in Minneapolis. Mayor Rybach was going to a lot of funerals of young people. And he said, you know, the only way I've found that I can connect in an authentic way with survivors of violence, with moms whose kids have been killed, is to imagine that it was my children who were killed. And he said, you know, one summer, I just realized that on some level, I had lost my children 9 times, and I didn't want to do it anymore. And I realized, you know, just doing law enforcement wasn't working. Just doing criminal justice wasn't working. And that's when he discovered the public health approach. He and the city council passed a resolution declaring violence as a public health issue. They developed a strategic planning process just like this. And they agreed through risk and resilience prioritization and using the spectrum that these were the 4 goals that they were going to focus on. Connect all youth to trusted adults, intervene at the first sign of risk for violence, restore youth who have gone down the wrong path, and unlearn the culture of violence. And what's really amazing is that when you go to Minneapolis now and you talk to faith leaders and you talk to the YMCA and you talk to Parks and Recreation, they can all say, this is what we're doing to prevent violence, and this is the goal of the blueprint that we're shifting. So really about coordination, it's about knowing your contribution to this larger plan. What is your role in kind of moving this issue and achieving the vision that you want for Hillsborough County? That's really what the coordination piece is. As a result, homicides of young people went down by 64% in just a couple years. And it's not even just that the violence is going down. It's kind of when you make sure that safety is guaranteed, kind of what positive things can flourish in that space, right? So we also saw that number of youth and city job programs increased by 134%. High school graduation rates went up. I mean, so many positive things just flowed out of reducing violence. And it was really about a coordinated approach. They didn't have money for more programs. They didn't have money for more evidence-based stuff to put in place. They really just scraped together the money to hire a full-time coordinator, right? It was just that one full-time coordinator who had kind of the big picture, who was able to connect different people in the city and the county, who was able to say, like, what are you struggling with? How can we support you in doing this piece of the work better, and who can we connect you with? Just having that one person in place whose responsibility was to coordinate this effort made the violence go down.
They also were the person that wrote proposals and tried to bring
yes.
in federal dollars and outside money, because they had the lens of being able to support the city. So it wasn't that they were advocating for one program or one neighborhood. They were being able to be much more competitive because they were advocating for the whole.
Right, exactly. We work with a lot of cities to do this work, and what's most exciting about what happened in Minneapolis is that it can happen in Hillsborough County too. Mm-hmm. That's the most exciting thing, is we're seeing it happen place after place after place. But again, violence looks different everywhere, and so will the solutions. So the fact that you're here in this room, ready to have those tough conversations to figure out what you want this to look like in your communities is so, so, so important to this process and its success. Some of the cities we talked to, they say this again and again. We need flexibility, we need to be fluid and dynamic, we need to utilize our own understanding of our communities. I know we talk a lot about data and about evidence. There are lots of different types of evidence, and a lot of that's right here in this room, in your heads, from your experience, from your professions. I mean, it's all gonna feed into this process and make it stronger. We're so excited to be here with you, and grateful that you're so willing and committed to making Hillsborough County a safer, healthier place for everyone.
Super. If you're interested in doing a little out-of-class assignment, the communications subcommittee said that they were overachievers early this morning. So if any of you are overachievers, there are some tools available on our website if you want to think through this. One is the Unity Roadmap. So this is the best thinking of about 13 cities. What does it take on the ground to prevent violence? And there's 9 elements. So you need programs, you need data, you need strategy, and there's examples from all of the cities in those categories. So that's the Unity Roadmap. It's available on our website. And if you need any help finding any of these things, just send us an email. We also have been looking about how to make the case. So what's the connection between violence and learning? What's the connection between violence and mental health, violence and chronic illness? Some of these things, it's like, well, obviously, right? But this is actually the science behind that connection, all of it noted from peer-reviewed journals, but also written in a way that you can kind of make the case to the folks in your community. We have all sorts of information about the spectrum. And then I thought this was an interesting one for you. This is First Steps to Preventing Violence. So this is the 0 to 5 group, and it gives case examples, but it does it across the spectrum, so you can see different levels of different policies. Again, all kinds of real-life examples from different communities. If you're interested in learning a little bit more about primary prevention, this is the textbook from Prevention Institute. The first chapter is available free online, so you can refer to it. If you have other people that you want to kind of get on the same page, you can see that available online. And then, our emails aren't on this. I didn't realize that. So I wanted to kind of leave you with our contact information. So it's just our names. You want to put that up there? Annie and Benita, and then it's at preventioninstitute.org. So we have an open invitation for you as you're thinking about this, for this project, for other projects. We are more than happy to support your work. This is what we do all day. This is what we love. And anything that we can do to help you, we would really welcome that. And she'll put that up there. We might need a couple days to get back to you because we'll be out training like we are here today. But please feel free to be in touch. So I want to leave you with one story. And then I'm going to turn it over to you, Commissioner Breckner. So I was 17 years old. And I had already met my true love, because 17, that happens. And I graduated from high school, was ready to go to Northwestern. I was moving from San Diego to Chicago, real excited. And the day after I graduated from high school, our phone rang in the middle of the night, and it was, whoops, you know, I'm pretty young, but it was in the days before cell phones. And so it was the house phone, and the house phone doesn't ring in the middle of the night. That was weird. My mom came in and woke me up, and she said, "Annie, do you know Nicole?" And I said, "Yeah, I know Nicole." And I'm thinking, what's happening? She said, "Annie, Nicole said that Willie's dead." And Willie was my true love. And it was the day after we graduated from high school. He was leaving a family party, and he was walking to his car, and there were some gang members that were not allowed into the party, and they shot up the front of the house in a car. And they killed Willie. And I remember that night very clearly. I mean, it's been many, many years. I still can't really talk about it too much. And I remember when they arrested the young men, they found the young men and arrested them. They were 15 and 13 and 17, you know, and the shooter was the 13-year-old. And I remember when they were charged with a crime. I remember being at school and someone calling me and coming out of class and finding out that they had all been incarcerated for the rest of their lives. And it's something that, when I think about this work, I'm not sure why. Oh, thank you, Commissioner. When I think about this work, it's something that drives me back to prevention every time. Because I don't want anyone to get that phone call, and I don't want anyone else to lose their life, because those 3 men lost their life that night too. They weren't smart enough to be aware of it, but they lost their lives that night too. And when you're in a community where young man after young man after young man is incarcerated and is killed. I live in LA now, and it's like, I'm getting PTSD from reading the newspaper. You know, we have 6-year-olds, and it's very real to sit here and say, we need prevention. We need to stop this from happening in the first place. And it's also very real that we need to act right now, because it's happening day after day after day. And what we've learned from the science is that the best way to prevent this long term is take a step back, convene with each other, take this time at a table, and start putting the plan in process. And we have a year to think this through, and that's way too much time, and it's not enough. And we're gonna come back to that tension. But what I ask you to do is think about your Willie and your friends and family in this process, and bring them with you as you come to these meetings. And we're gonna honor you, and I hope you'll honor the process, and I really, really look forward to working with you. Thank you.
Well, I want to thank again Annie and Benita. Let's give them a round of applause one more time for joining us here in this effort. Have all of you found this to be beneficial and valuable today? I hope, as Annie and Benita had mentioned, that you take away from today that violence, again, is not just the sole responsibility of law enforcement. And speaking of law enforcement, I want to recognize, who joined us partway through the process, our Chief of Police of Tampa, Chief Castor. Why don't you stand? Chief, we want to thank you again as we recognize you and the sheriff earlier for your valiant efforts of reducing violent crime in our community by 45%. You continue to do that since 2008. You all continue to do an awesome job with the men and women of law enforcement protect our community. But what we recognize here today is that, again, the efforts of law enforcement needs the help from our community. There are over 4,500 crimes, violent crimes, that have been committed in Hillsborough County since 2012. 7,500 cases of domestic violence, and over 10,000 cases of child abuse. And all the great law enforcement techniques and practices in the world can't get that number a whole lot lower without our help. And it begins with a collaboration, it begins with a process, it begins with a process that we are going through here today. And it begins with each and every one of you taking responsibility, stepping up to the plate like you have, and engaging in the process to work together as a community to help reduce violence. So I want to thank you again for your commitment to this process. I also want to recognize a key person here today that has helped organize here that I neglected to mention before when I introduced staff. Bob Sheehan, why don't you stand up for us? Many of you have worked with Bob. and be working with him over the next year. And a couple of housekeeping reminders. The Leadership Council, we have our next meeting on October the 8th at 1 o'clock, and that's going to be hosted by Mayor Chalura in Temple Terrace. And so we thank you for that. Subcommittees, you are going to be meeting on November the 7th, and so you'll start your work and you'll get some pre-work ahead of that, so that'll be on your calendars. And one final thing, I want to make sure that you all, in your packet, you turn and you take an opportunity to fill out the survey from Prevention Institute. This is absolutely valuable to them and to us so that we can get your feedback on today's session and then also your thoughts going forward from here. So again, we want to thank you for coming out. Mayor Buckhorn, thank you so much for graciously hosting today. And ladies and gentlemen, we look forward to working with you on this journey over the next 12 to 18 months. So thank you very much.